And let's take you to our breaking news story tonight. The death toll from the Hammanskraal Cholera outbreak north of Pretoria rises to 22, with a person dying from cholera in the Free State. The number of laboratory-confirmed cases in Hammanskraal stands at 29. The Health Department says 179 patients have been seen at the Jubilee District Hospital in Hammanskraal since yesterday, and this includes 18 patients who were transferred to the Dr. George Mukhari Academic and Steve Biko Academic Hospitals in Tshwane. At the same time, EFF members went to the Temba police station to lay criminal charges against the city of Tshwane and the Gauteng government. They say the municipality should be held accountable for the cholera-related deaths, as it failed to provide residents with safe drinking water, a basic human right. It says the 20 deaths could have been avoided had the local and provincial governments intervened. The source of the outbreak remains unknown. Water from bulk supplies and the local water plant have been cleared of contamination. Well, let's talk about today's developments and find out whether the operational plan that government's now put in place is a winning plan that will finally deliver clean drinking water to not only the citizens of Hammanskraal, but elsewhere across the country where they have contracted cholera, ostensibly through polluted water sources. And I'm going to welcome Carin Bosman, who specializes in environmental and water resources now. And Carin joins us now for more. Carin, good afternoon to you, and thank you so much for being with us on the program. If you've been following the story since the very beginning, so many different messages. What should the public, as you watch this as an expert, what should the public be aware of here that we are not talking enough about from an environmental governance perspective?
Well, I think the first point I would like to make, something you've just mentioned, where the city of Tshwane has announced that their wastewater has been cleared from contamination with cholera. That's actually not correct. That is misinformation. Because the statement that they released says that they tested the water for fecal coli and E. coli, and therefore, because there's no fecal or E. coli, there's no cholera. But that's not true. The only tests that you can use to determine if there's cholera in the water is a PCR test or a culture growth test. And they haven't done those tests, as far as my knowledge goes, on the effluent from Rooiwal Sewage Works, Daspoort Sewage Works, or the Temba Water Treatment Works. So I'm struggling to get confidence in the official statements made by the city of Tshwane if they don't do the correct scientific test to tell us without any doubt that there's no cholera in the wastewater or the water provided to the people. The test they've done is simply not sufficient.
I'm standing in front of you now, hearing that, and thinking about that community, thinking about the uproar in the Tshwane City Council, which has turned this matter into something political, and thinking that it all goes back to playing politics. Would you agree with that, Carin, that the city of Tshwane is gambling with the lives of the citizens of the city?
I cannot disagree with you on one point. It was absolutely disconcerting for me to see how the mayor of Tshwane goes on a political PR exercise to the hospital, where he should have gone to the water treatment works and the sewage works and ask and check for results there. It is as bad as when they did the PR stunt a couple of months ago, handing out somebody in Gauteng handing out sanitary pads to schoolgirls, where school children don't have proper sanitation and fall down long drops.
So what you're saying
in our country in 2023.
So what you're saying to us is that the testing that the Tshwane mayor announced and talked about is the wrong test, number one. And so the message that he's put out has been the incorrect and, in fact, a dangerous message. When I spoke to the Deputy Minister of Water and Sanitation yesterday, Deputy Minister David Mahlobo, he talked about this culture test. I can't remember the PCR part, but he did talk about a culture test and that being a definitive way of knowing what's in the water. When you look overall at the operational and the action plan that the government has put together, is it, in your view as an expert, a competent plan? They've got a panel of experts, they brought in some laboratory testing and so on. When you appraise that, is it good enough? Is it the right plan?
Well, no. I wrote a guideline on dealing with cholera outbreaks for the Department of Water Affairs in 2002. And there's so many gaps in what I'm seeing, what they're putting forward. The one thing that is seriously lacking is rehydration centers, because people die literally of dehydration. The diarrhea is so fast, so extensive, that they dehydrate within a matter of hours. So the first thing you need to put up is rehydration centers where you can give people salt supplements, rehydrate or something, to rehydrate them if they show any symptoms. And then the second thing that I find quite lacking is that the expectation that bringing water tankers in will be enough, because we've seen in other cases that these water tankers are not necessarily filled at from water purification works, but sometimes from a river without any purification, and there's no testing done to make sure that what is in the tanker is proper and is actually good for people to drink. Thirdly, there's not enough water tankers to serve the hundreds of thousands of people that live in the Hammanskraal area. And I would recommend that they look at things, modular treatment plants. You can get these modular treatment plants that are locally made in South Africa, which can be up and running within a week or two, to treat water to a standard that is suitable for human consumption. And that is just in the short term. Is things that I don't see is a coordination committee between the different departments. I see all of them trying to score political points out of people dying, but I don't see a togetherness and a bringing in of people with expertise who's dealt with previous cholera outbreaks, who can advise and say, hey guys, water tankers is not going to make it, and it's not enough, because we saw on your footage you showed earlier of the woman getting water in a running stream, and that water is not suitable for human. So if you can't just tell people put jig in the water and let it stand overnight in an impoverished community, you need to provide that disinfectant to the people. But I don't see any provision of disinfectant to the community at all.
Carin, I'm running out of time, but I want to put two things to you before we go. The Deputy Minister told me last night, he will literally guarantee that the water tankers have been filled up at a credible source, and he cited Rand Water and one other, that the water is pure, it's safe for the community to drink, and that's what's being deployed. You're sharing that maybe there's not always that integrity of supply. They've got to constantly check and make sure that those tankers are being filled at a source that is uncontaminated. But the thing that boggles the mind is you wrote the guideline on how to deal with a cholera outbreak. Has the Water and Sanitation Department called you, Carin Bosman, and said, join us, help us figure this out?
Not a word.
Should they have?
I mean, if they have many, there are many qualified people working in the Department of Water Affairs. The Deputy Minister, David, I do know him quite well. I trained him in pollution-related things a long time ago, long before he was in politics. So they are quite qualified people. I just don't know if they have used the available knowledge and management plans and structures because I see these gaps that I've just mentioned.
Carin, it's just, utterly disturbing to us tonight. And when you say literally politicians are playing with the lives of people, we've already seen people die. And this is a continued practice. This is what they continue to do. If people are getting held accountable when they murder somebody, they go to prison for that. When 22 people die as a result of people not doing what they were supposed to be doing, shouldn't we also hold them criminally? That's the question. Thank you, Carin Bosman. Really appreciate your time, your analysis tonight. Carin is a specialist in environmental water resources. All right, so that's our interview tonight on the state of politics and politricks in the city of Tshwane. Let's stay with the theme. Health officials, including the Health Minister, members of the National Institute for Communicable Diseases and the World Health Department are all expected to visit the Jubilee Regional Hospital in Hammanskraal later tonight. And we'll tell you more about that story a little later on.